So as a clinical department within our medical school, we're concerned with medical education, but mainly with diversifying our medical education work, our medical workforce, and making sure that, particularly here in Hawaii, that Native Hawaiians and Pacific Islanders have access to our medical school. We need to increase the numbers of physicians from our communities. Right now, the Native Hawaiian Pacific Islanders represent about 25 to 26% of our state's population, but certainly they're not anywhere close to being that percentage for our medical workforce, and we're wanting to change that. We feel strongly that it brings more relevance to medicine, more cultural competency, and it'll increase the number of people from our communities that want to come in for screenings, for primary care, and so forth. So we're doing that. We have a lot of pathway programs, federally funded, state funded, that help us to do that. And our goal is eventually parity. So if 25% of the state's population are Native Hawaiian Pacific Islanders, at the very least 25% of every incoming class every year into our medical school should be Native Hawaiian Pacific Islanders. And that's our immediate goal. In the way of research, we have a lot of National Institutes of Health funded research projects. We do mainly intervention projects or community-based participatory research type projects. We're very closely with our community partners. Some of them are clinics, federally qualified health centers, some of them are grassroots organizations, Native Hawaiian healthcare systems, but trying to find the solutions that they see viable to put into the scientific question and pursue. So we have a number of randomized control trials working with communities, looking at culturally grounded approaches to improving the health and well-being of our communities. And a lot of this are funded federally. And those are things we're also looking in that area to increase the health science workforce. So more people from these communities who are becoming scientists and asking those innovative, unique questions that can only come from people who understand those life experiences and so forth. But also develop sustainable solutions. If it just ends up on a bookshelf after a 5-year project, it's no use. And the other thing we're very strongly associate or seek is really community engagement at all levels. We feel strongly that community voices need to be a part of academic science and healthcare. They are the stakeholders, they are the folks that are impacted by what we do. And therefore they should have a say in what we do from beginning to end, not midway when we need recruiters for participants or things. So those are the things we're working on.